my hope for Kratom is that somehow it will be regulated. And, I think with regulation, there would be standards to protect the consumer so that when people buy a product, they can be pretty sure that it meets federal standards, that it is what it claims to be. It's not adulterated with other drugs. It's not contaminated with ridiculous levels of toxic metals. That doesn't mean it has to be completely free of metals. When we use oregano in our spaghetti sauce or marinara sauce, there are toxic metals and germs. There are microbes in herbs and spices that we use all the time. But they're regulated. There are standards for what the microbial burden, what the metal burden have to be. They have to be within certain limits. And the federal agencies have standards for most products. I think that the move to withdraw the proposal to schedule the mitragenines as Schedule 1, I think it signals that the federal agencies are more willing to look at the science of Kratom and make a decision. And if it's found to be, something that has useful properties, it might have some toxicities, but the benefits outweigh the potential risk. And we can come up with standards to identify what an acceptable product would be, what would be acceptable dosing, and regulate it. I mean, we've managed to regulate some pretty dangerous drugs without making them Schedule 1 substances. The best is nicotine. That's the best example. I mean, people could buy nicotine gums, nicotine patches, and it's a powerful drug. If we could do that with nicotine, we could do it with caffeine. Why can't we do it with Kratom and the mitragenines?